Hello, I'm Julie Eistars. I'm an advanced practice nurse and a lung patient navigator at Northwest Community Healthcare. I also facilitate our lung cancer screening program here and have done so since 2011. I'm going to talk to you today about lung cancer screening. It's a lifesaver, and I'll explain why. But we really can't talk about screening without first talking about lung cancer and the progress we're making in the United States in diagnosing and treating the disease. Especially over the last 10 years, there's been a lot of progress. Looking at data from the National Cancer Institute Surveillance Epidemiology and End Results Program, or SEER, estimates indicate in 2020 there will be more than 228,000 new lung cancer diagnoses and more than 135,000 deaths from lung cancer. It's the second most common cancer and the leading cause of cancer death for both men and women. It claims more lives than colon, breast, and prostate cancers combined. Nearly 18% of people diagnosed have never been smokers. That last statistic is really kind of surprising. I wanted to bring it up because it's not just a disease of smokers anymore. The good news about lung cancer is that we have made progress. The incidence has been declining since the mid-1980s in men and since the mid-2000s in women. One reason for that difference is that men were smoking longer than women. One important thing to know is that there are more than 500,000 people who are surviving lung cancer in the United States, so there is life after lung cancer. From 2007 to 16, new cases of lung cancer decreased by almost 3% per year in men and by 1.5% per year in women. The death rate has dropped by 51% in men since 1990 and by 26% in women since 2002. So more recent statistics from 2008 to 17, the death rate dropped by 4% per year in men and 3% per year in women. So we are doing much better. We have to talk about the 5-year survival rate to realize how serious of a disease it is and why it's so important to catch it early. With stage 1 lung cancer, there is a 61% chance of surviving for 5 years or more. So the sooner the cancer is diagnosed, the better chances are for survival. With stages 2 and 3, the cancer becomes more advanced and it drops to 35% survival rate. Then with the most advanced stage being stage 4, the chance of surviving for 5 years or more decreases to only 6%. If it's localized, there's no signs that the cancer has spread outside of the lung. It's also known as stage 1. When lung cancer is regional, the cancer is spread outside the lung to nearby structures or lymph nodes. This occurs in stage 2 and 3 lung cancer. Lung cancer is considered stage 4 when it's spread to distant parts of the body, such as the brain, bones, liver, or the other lung. At stage 4, there may be fluid around the lung as well containing cancer cells. Stage of lung cancer really matters, and that's why it's so important to catch it early when it's more treatable and curable. Prevention is always best to not only lower your chances of developing cancer, but also to help you have a better quality of life, which is really the most important thing. Steps you can take include maintaining a healthy weight, eating a balanced diet, meaning less processed foods, and consider a primarily plant-based diet. Live an active lifestyle, exercising regularly. Walk instead of drive are things that you can do, taking the stairs instead of the elevator. There's other ways to stay active like sports, dancing, things that you enjoy. And then drinking alcohol in moderation, if at all. Check the radon levels in your home. People often don't know that radon is the number 2 cause of lung cancer. It's prevalent in certain areas like the Midwest. And quitting smoking is still the number 1 way to prevent lung cancer. By screening for lung cancer, we hope to catch it as early as possible. It's also important to know your family history. The number 1 risk of cancer is aging, not just lung cancer, but all cancers. People who have had cancer in their family history in their 40s or younger may have a reason to go for genetic counseling. Signs and symptoms of lung cancer can include chronic coughing, wheezing, a whistling-like sound like an asthma, chest and bone pain, sometimes shoulder pain, difficulty swallowing, shortness of breath or a change in your breathing, and unexplained weight loss, meaning you weren't trying to lose weight. People often think coughing up blood is a sign of lung cancer, but you could be coughing up blood for other reasons. It doesn't happen that often actually in lung cancer, but a change in a cough can be a sign. For example, if you have a smoker's cough and it gets worse, or if it's more frequent, and you have wheezing, where you can actually hear that whistle, that could be a sign in some cases. So what is lung cancer screening? It's a low-dose CT or a CAT scan of your chest. It's much like a regular CAT scan, and it's done on the same machine, but we use different settings on the machine. It takes only about 5 minutes, and you're lying flat on your back. There's no special preparation. You wear comfortable clothes. It's not invasive, no needles, no IVs. It's the test we use to help detect lung cancer at its earliest stage, before symptoms even start. So why should we screen for lung cancer? Mainly because you want to find lung cancer at its earliest stage. Lung cancer screening reduces the risk of dying from lung cancer by at least 20%. We know this because of a landmark study called the National Lung Cancer Screening Trial, which ran from 2002 to 2010. The study was actually stopped early when they saw the benefit. Who's eligible for lung cancer screening? If you're between the ages of 55 and 80, you're more likely to get it as you age. Medicare covers up to age 77 as far as insurance, and then private insurance will cover to 80 years old. If you're still smoking or you've quit within the past 15 years and you have no other signs or symptoms that are new, that might warrant screening. So symptoms like unattended weight loss, cough, shortness of breath, symptoms of lung cancer would take you down a different path. If you smoked a pack a day for 30 years, or you smoked 2 packs a day for 15 years, that would give you that 30-pack-year history. You need at least that to be eligible. How do you get screened? First of all, you have to be eligible, as we've talked about. It does require a doctor's order, and shared decision-making is a very important part of screening. Shared decision-making means, like with any decision you make, you're looking at your benefits versus your risks. So the doctor is going to discuss that with you. What are the benefits and what are the risks? Right now we're having people screen every year until they've quit smoking for 15 years. It's not just a one-time test. Your ability or willingness to undergo diagnosis and treatment is important because there's really no point if you're not willing to go through potential diagnosis and treatment. When you come in for lung cancer screening, we take a 3D CT image of your lungs. It's tiny slices or detailed pictures. This image shows just one slice. When you're looking at that scan, you're looking opposite. On the left side of the scan, you're seeing the right side of the person's body. It's like you're looking at them from their feet while they're lying on their back. The second picture shows you a nodule. It has little spikes, and that's called spiculated. That makes it more suspicious. The larger the nodule is, the more suspicious it is. If it's not quite solid or if it's kind of opaque, that's not a good sign. There are certain things that radiologists look for when they say this is something that needs to be followed up, or we need a biopsy. What does it mean to find a lung nodule? If you hear that you have a spot on your lung, which is often called, and you know how common it isn't as frightening. You don't have a reason to get too concerned about it initially, but it does need to be evaluated. So just to give you an idea, about 95% of these lung nodules are not cancer. Some of them are really tiny, measured in millimeters. At least 50% of people have nodules showing in their lungs on imaging by the time they're 50 years old, and it is more common in smokers. Lung nodules can be one of 3 things. It can be infection, even if you weren't aware of it, can be scarring, or it can be cancer. Nodules that are large, look suspicious, or have changed over time will need further evaluation. An evaluation might be a consult with another doctor, a specialist called a pulmonologist, and he or she might do a CT of your chest or a PET scan. A PET scan is a little more involved than a CAT scan, and it covers more of your body. And you want to see if there's anything that might be cancerous. A biopsy might also be done. Here are the risks and benefits of lung cancer screening. The main benefit is that we may be able to identify cancer at its earliest stage when it's most curable. That's really important. That's a huge benefit. There's also the incentive to quit smoking or tobacco use and potential incidental findings. For example, screening might find another cancer somewhere else, such as in a kidney. Radiation exposure is something that people worry about, but it's not as big of a risk as you would think. However, you still want to discuss the risks and benefits with your healthcare provider. Basically, for comparison purposes, a CT of the chest is equivalent to an X-ray of the whole spine. Other concerns are false positives or false negatives. So a false positive occurs when something that looked like a cancer is found and you could go all the way to even a biopsy and then it turns out it's not cancerous, it's negative. False negatives are when a test designed to detect cancer returns a negative result, but the person actually does have cancer. These are reasons why close follow-up is important to make sure that if something is detected, we check over time to see if it's growing. Overdiagnosis can be a concern in some cases, and that would be finding a very slow-growing cancer that will not cause a problem for years. Anxiety related to findings is another concern. So the more you know about lung nodules, the less worried or frightened you would be. Complications from a biopsy or surgery can be a risk, because with a biopsy you can have bleeding or an infection, or you can have a lung collapse. And with surgery, sometimes more serious complications. If you are diagnosed with lung cancer, know that we offer advanced treatment options for lung cancer, including precision medicine, which is customized cancer care, interventional pulmonology procedures, video-assisted thoracic surgery, robotic surgery, surgery to remove the entire lung, the lung lobe containing the tumor, or a portion of the affected lobe. Halcyon and CyberKnife are two types of radiation treatment that are focused, and other advanced radiation therapies, and then chemotherapy, immunotherapy, and targeted therapy. The takeaways from all of this are that the single best way to reduce lung cancer risk is by quitting smoking. And the best way to catch lung cancer at its earliest stage is by undergoing lung cancer screening. Remember, lung cancer is most treatable when caught in an early stage. Talk to your healthcare provider if you think you are eligible for lung cancer screening. For more information, feel free to contact me directly at 847-618-6572. Thank you.